Hi, I'm Dr. Kathleen Schuster and I am the clear aligner cowgirl. I wanted to share with you about tongue ties today and what we can be looking for in dentistry and how I'm seeing that they're affecting arches. So today I'm going to share with you what you can look for with your own patients with tongue ties, what myofunctional therapists are looking for, when you should be sending them to myofunctional therapists, signs that they might be, your patients might be helped by a tongue tie release. There are a lot of things that we can look for, that we can do to help our patients to live better, to function better, to sleep better, being able to look at these things. So I'm going to share that with you today. So first thing, what I look at when I'm looking at tongue function is I actually start with looking at the teeth and the jaws, because our tongue should be our natural palate expander as we grow. And when I see really narrow arches, typically that's a sign to me that we've got some kind of tongue tie or tongue restriction. Really high palates, again, tongue restriction, unless maybe they had a thumb habit or a pacifier habit as a baby that we just didn't grow the way that we were supposed to grow. I also look at the inclination of the teeth. So I oftentimes, if I'm seeing a patient that's class 2, that tongue restriction, often I find it pulls that bottom jaw back during growth. If I'm seeing that the anterior teeth, instead of being slightly proclined, if I'm seeing that they're retroclined, that also is a big sign to me that we have some kind of tissue restriction that's pulling everything in. If I'm seeing posterior teeth that instead of being straight up and down are retroclined as well, oftentimes that's a sign to me that we don't have good tongue function, because instead of the tongue doing all of the work where it's pushing the bolus to the back of the throat and down the throat, instead we're seeing that the cheeks are, the swallow reflex isn't proper, and the cheeks are pushing a lot to help with that swallow reflex, and they're helping too much to chew and to move the food around. And so the cheeks, when they're not swelling properly, are pushing the teeth in. So those are all just initial things that I look at when I'm looking at a patient's, their outside structure, with them being class 2, with sometimes class 3 as well, because again, with that tongue being that natural palate expander, if they're deficient in their maxilla, sometimes their top jaw didn't grow where it was supposed to either. So those are things that I look at from the outside when I'm evaluating their bite and their skeletal structure, to even see if I should be looking for a tongue tie to begin with. When it actually comes to looking to evaluate them if they have a tongue tie, I have them put their tongue between their 2 front teeth. So I start with letting them know that this is going to be really weird, and it's going to take a minute for you to figure out where your tongue is supposed to go. So I'm going to have you relax, and then I'm going to have you open as big as you can, and I'm going to stick my two fingers up underneath your tongue, and I'm going to apply just a little bit of pressure there. And then I am going to have you take the tip of your tongue, and I will often, obviously with a gloved finger, touch the tip of their tongue. I'm going to have you stick the tip of your tongue between your 2 front teeth on the back side on the roof of your mouth, and then I will touch up there. So we're going to touch right there. So let's try this together. It's going to be a little weird. It's going to take you probably a try or 2 to get there. So this is how I do this. So I have them open, 2 fingers. Now, I can't do it because I have a tongue restriction, so I will get closer so you can see this. If you see that Eiffel Tower right there, that is a dead giveaway. They've got a tongue tie, they've got a tongue restriction. Mine isn't incredibly significant. If you see that, that string, that tie going all the way up to the tip of their tongue, you will also notice just as they're moving around that they'll almost get a heart shape to that tongue. Because I have that tongue tie, that tongue restriction, I cannot touch up between my 2 front teeth without closing down without getting some jaw compensation to make there, because my tongue just does not stretch that far where it should. Something that I will often see is what they call floor of mouth compensation, where they will really try to strain with the muscles underneath their tongue, and that is why you use your 2 fingers to gently hold that down right there. Most of the time, the first time they do it, first or second time they try to do it, they do a good job of getting their tongue up there to where it's supposed to be, but they really use those muscles and they really use their jaw to close. They get a lot of compensation in doing that. And this is typically, if I'm already looking at them and I'm seeing all of these signs that they have a tongue tie restriction, when I go to do this, oftentimes I already know what I'm gonna find. They're not gonna be able to do what I'm asking them to do. So I will kind of show you what that looks like by me doing it myself, and that after I have them do that and they kind of figure out where they're supposed to be going, I explain to them, okay, we're gonna do this one more time, and I want you to not force your tongue up there. I'm gonna use my fingers to hold the muscles down in place where they're supposed to stay, and I want you to not close your jaw. And typically at that point, they will be able to see that they cannot do what you are asking them to do. So I'll do it for you. This is what I often see the first time. Oh, I should get my fingers out of the way for you. Hold on. Now, I don't do it too much, but the floor of the mouth will typically come up right there. In order for me to do it, I do have to close down a little bit. So that looks like this. And so you'll see how my jaw closed a little bit in order for me to get up there. If they have to close halfway or more, that is a very significant restriction. If they only have to close minimally to get there, or you only see a minimal restriction, maybe they have a little floor of mouth compensation, but they don't have a ton of jaw compensation, then sometimes those restrictions can just be stretched out with a myofunctional therapist or some myofunctional exercises. But if you're seeing them significantly have to close to get there, if you're seeing that Eiffel Tower, if they tell you that they're having sleep issues, those are all signs that they could really benefit from myofunctional therapy, number one, and a tongue tie release. So as a dentist, if we're looking at doing a tongue tie release, why is myofunctional therapy so important to have our patients do that and engage in that? And the reason is that when your patients are like this, they've been like this their entire life, and they only know how to function this way. And because they can't function properly, they've lost the musculature that they should have in their tongue. And so doing these exercises and starting to teach the tongue how to move, and then also stretching out the tongue is gonna allow you to be able to get a deeper release. And then as soon as you are done with that release, they need to be moving their tongue so that we don't get reattachment. And so that looks like scheduling with their myofunctional therapist immediately after. Now, if you have a patient that has declined to go to a myofunctional therapist, a tongue tie release can still absolutely be helpful. I would suggest giving them some exercises to do beforehand to help you out and to help get a better result, and then make sure you are prepared with exercises and stretches and things for them to do immediately when they're done. And I am more than happy to give you and share with you the exercises that I have my patients do and before, and the stretches and exercises that we do after for those patients. So I also do like to explain to my patients why myofunctional therapy and the tongue tie is so incredibly important to get it resolved. I have had a lot of patients in my practice that have had braces, aligners in the past, sometimes on multiple occasions, and the way that everything functions afterwards will cause relapse from orthodontics. even if they're wearing retainers. I've had patients that have worn retainers and still gotten major relapse, and oftentimes I have found it's because they have a significant tongue restriction. So that's a good thing if you have a patient that's going into aligners, to be able to share with them if they've done it before and they had relapse. Even if they say, well, I didn't wear my retainer, if you're seeing significant relapse, then there is a very strong possibility, if you're looking and you're seeing that they're having a tongue restriction, that they may need to get a tongue tie release done before they're finished with their aligner therapy. Honestly, I recommend doing it before you start or even in the middle of it, because it's such an incredibly easy procedure, and it will help your aligner therapy to actually go better if the body isn't constantly fighting those restrictions that are happening. Another thing that I like to explain to my patients when I know that they're having sleep issues is how that tongue tie and that tongue restriction affects their sleep. So, being able to evaluate tongue ties in dentistry is incredibly important. It really affects all the care that we can give them. It affects their functionality. It affects their sleep when we have those tongue restrictions. It affects the work that we do as dentists, and being able to evaluate those tongue ties, being able to refer to myofunctional therapy when it's beneficial, being able to do tongue tie releases can all be incredibly beneficial for not only for your patients, but for the efficiency and the efficacy of your dentistry. They can really absolutely help you. If you loved this and you found this helpful and you want to learn more, I am going to be doing a master class on all of this in the end of February. You can sign up for it on my website, and I am going to go over more in depth everything that you should be looking for, different grades of tongue ties, posterior tongue ties, because those are incredibly difficult to diagnose. Talking with your patients about those tongue ties and tongue tie releases and myofunctional therapy, and what exercises you can give your patients prior to a tongue tie release, and exercises and stretches you can give them afterwards. We will go full-fledged into everything that you really need to know in order to be able to effectively communicate with your patients, and also to be able to provide them with the excellent, amazing care that they need, and that is going to make your treatment even better. You can follow me on Instagram at Clear Aligner Cowgirl. My YouTube website is obviously Clear Aligner Cowgirl. Please do comment below. I will also tag my website below so that you can look there if you want to join me for that masterclass. I would love to see you there. Love to see your